Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health and also an ABC News contributor. Dr. Ellerin, thanks so much for joining us tonight.
Hi, Lindsay.
How dangerous are crowds like what we've been seeing the past few days when it comes to COVID-19?
Yeah, so crowds and COVID-19 are a dangerous combination. I want you to think of these four categories as far as risk of spread of this virus. So people, place, time, and space. So when we're talking about people, large crowds being close together, that's very dangerous. And remember, a lot of these protesters are Black Americans, which makes sense, but their risk of dying from COVID-19 is more than twice that of whites. So we have to remember their healths are at risk, and then when they go home to their families and friends, they may be at risk of getting severe illness from this. And then you want to think of place. Now, the place is outdoors. That's a good thing. That's a mitigator. But then we have time and space. These protesters are spending hours shoulder to shoulder, face to face. That is going to propagate the virus, and there's a risk of spreading more of these COVID fires. Now, remember, many of the protesters are masked, but we're watching the crowds. Masking is uneven, and masking may not work as well when you have people yelling, spitting. The masks are really, it may not be able to hold on to those respiratory droplets, which may aerosolize when you yell.
Those are all very good points. And if you're set on joining one of these protests, what would you say is the best way to protect yourself? Some advice that you would give to somebody who says, this cause is important enough for me to be out there?
Okay, well, first of all, if you have chronic conditions or are elderly, you really have to think twice. It's safer to stay at home and figure out a safer way to protest. But if you are going to get out there, masking is very important, and I would even consider shields, like welder shields, that really protect the eyes as well, because the mask protects the nose and mouth, but not protecting the eyes. And if you get those infectious droplets into your eyes, that's a way that you could get infected. Hand hygiene is very important as well. Obviously, physical distancing is extremely important, but that's not really, with many of these crowds, that's not realistic.
And amid all of this, most states are starting to slowly reopen at this time. So where do things stand in the fight against COVID-19 in the country right now?
Well, the good news is that most states in the country, cases are declining, but some of that is predicated on how much we're testing. I think the key is we want to take our foot off the brake gradually and place our foot on the accelerator gradually. We can't go 0 to 60 quickly. Otherwise, we're just going to lead to another outbreak.
Dr. Todd Ellerin, thank you so much for your time.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.